Hi, like Marcos said, my name is Beate, and I work for the Norwegian Cancer Society. At the Cancer Society, I do digital fundraising, digital communication, and that's everything from social media strategy to writing and creating content, to making sure that our donation forms are as good as they can be, and everything else in between that you can think of. And what I will be talking to you today about is something that I think is very, very underrated in fundraising. We do all of these things to attract attention and to make something go viral and to get people to come to our website and be touched by our content. But then when we do that, we actually send them to very crappy websites most of the times. So I'll be walking you through the case study of how the Norwegian Cancer Society redid our webpage and how that actually led to a doubling on all types of online income. So I hope you'll enjoy that. There is this very stubborn myth that exists in fundraising, and it's the myth that if someone has decided to support your charity, surely they'll put up with an extra form or extra field or two in a donation form because they want to give. People are good, they mean well. But what we have found, and what I'll be proving to you today, is that that is simply not true. Some people are dedicated and will go through fire and ice for you, but most people, they will just stop if the barriers of getting there are too high. Because it's a bit like this. Like, imagine this is you, and you want a hot dog. It's like, that'd be good right now. I'm a bit hungry. I'd like a hot dog. And so you do, as you do when you feel like you need a hot dog, you go to the hot dog stand. And then this is what meets you. Do you still really want that hot dog? This is real life, and this is the same online. Someone might see your YouTube video and feel like, I need to support this cause, and they go onto your webpage, but if the line is too long, they're going to be not going to be bothered, and they're going to not give you that donation. Making a donation is usually an emotional decision, not a rational one. So the minute you introduce rational thought, your conversions are going to be going down, your donations are going to be going down, and you're not going to actually get the gift. And the thing with fundraisers is that we tend to think we don't get that much money online. We tend to think that we have so many other legs to stand on. We get most of our money from something else. So what we're seeing is the low amount of money we're getting online. We're not seeing all the money we're not getting. If we were a web shop that were relying solely on our income from the website, we would be bankrupt years ago because we're not giving it focus, because we're not seeing the money we're not getting. But hopefully today you'll see a bit of the money that you could get if you just work a bit more with this. And what we've seen with this process is that people have gone from meaning well to doing well. And the results that I will be back to, but they're pointing up, 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 up. So the new Cancer Society website was a big deal. This wasn't just like tiny tinkerings. We had a 6-year-old website. We had, the backend was 6 years old. I myself, who know coding and who know like all kinds of technical stuff really well, I couldn't figure out how to put a picture into a post there. It was that complicated. And the editorial structures was also 6 years old, and it was from the time when people felt it was important that everyone have a say in what goes on the website, which led to us having a website that was cluttered, that was unprioritized, unstructured, and there were maybe 50 or 60 different people that had access to publishing on our website. Out of our 180 employees, a third of them could go on the website and publish. And there were innumerable stakeholders. We had the management, of course, you had the fundraisers, you have people working with prevention of cancer, you have the cancer nurses, everyone had a stake in our website. So it was a big deal. This is what it used to look like. And it's not half bad, but it is completely unstructured. If you see, obviously you can't read it, but if you see all these menus on top here, they are built the way our organization was. There was one box for each section of the organization. So there's the one thing that people do when they come to the Cancer Society website is to look for information about cancer. That's the #1 reason you would go on this page. And that's this tiny link up here, completely unproportional to what people came there to do. So we really had to start from scratch. And when you start from scratch with such a big web page as we had 5,000 pages on here. It's a little bit like moving from a giant office block and into a tiny apartment. And if anyone has ever moved from a house to an apartment, you know that it's almost impossible to do that without actually just scrapping everything you got, start fresh, buy new furniture, because you can't really scale down. So that's what we did. We started all over, we threw out everything, and we started again. And we had to really start with the basics. Why do we have a website? Why do we want a website? What's the goals of this website? Why do we want it? And this was a long process. We had the help of a great agency called NetLife Research, who took us through the website process. And the first thing they did was sit down with our board, and they said, okay, so what are the goals of the organization, and what are the goals you want the website to help you with? And we ended up with a list of 4 goals. And the first one is to ensure support for patients and next of kin. This is the #1 thing that we want our website to do. The #2 thing that we want our website to do is to increase the knowledge about cancer and prevention, how not to get cancer. The #3 thing that we want is for more people to be using our services, but using them online so it doesn't cost us more. For instance, talk to a cancer nurse. You can do that online rather than show up at our office, which is much more effective, and which means we can reach much more people. And the #4 thing was to improve the Cancer Society reputation. And you may notice that none of these 4 goals are actually fundraising. Only under the 4th goal was a tiny bit about how improving our reputation means we should measure it by seeing if we get more money. This leads to a very grumpy fundraiser, because I really, really wanted fundraising to be a priority for the new website. But I lost that battle, and so I had to sort of turn that frown upside down and work with what we had and to see how I could use this to get people to give us more money. And we did this by working with something that's called the core model. This is a model that the agency NetLife Research uses, and it's based on the fact that almost no one comes from your front page. There's only about 25% of our visitors that start on our front page, so navigation from the front page isn't important. What the front page looks like isn't important. Who's got the most space on the front page is completely unimportant. But what's important is your core content. So we sat down with a huge amount of scenarios, and we filled out these things. So the arrow going into the box is, how did they get here? One could be, they got here by searching for lung cancer on Google. And so we've got the core, which is our content about lung cancer, what they came here for. So that's a very clear, well-written article about lung cancer that helps you. And then we try to think, what might you be interested in next? What's relevant for us to introduce to you at this stage? So that might be signing up for a course that we have, helping you deal with cancer, or contacting the patient organization for those with lung cancer so you can meet others that are in the same situation. It's all about showing relevant content. Another might be that we have posted a link on Facebook about this month's research project. And so you would click from Facebook and come into the core, which would be the article about research. And then we'd say, okay, what are relevant ways now? Relevant, if you're reading about research, might be to actually donate towards research. So, so this is how we've been working through context to get people to give more money. And This means also that we're working very hard on not duplicating the content. For instance, before we used to have one section of the website that was called About Cancer. And you'd go in there and you'd read about skin cancer. But on the other hand, we'd had another section of the website about prevention and about staying smart in the sun. And there would be a second article about skin cancer, which wasn't the same as the first one. And there was no link in between them, which means we were doing twice the work and creating content that was competing with each other on Google. And none of it was updated because we'd always update the one but not the other, and then the other way around. So using the core model was what led us to really focus on the content. And another thing that led us to focus on the content was working mobile first. Our new website is responsive, which means that no matter which device you're on, if you're on an iPad or on your smartphone or on your desktop or on your refrigerator, for that way matter if you have like an internet refrigerator, you'll be on the same website. It just scales with you. So you'll always see the same content. It's just adjusting the way you see it. The boxes are moving around depending on the size of your screen. And when you're starting to work mobile first, more than half of our visitors now come from mobile devices, so we really have to work mobile first. This allows you to actually focus on the content, because when you're working on a small screen, the content is really all there's room for. So you have to focus on making great content. And then when you expand to bigger screens, yeah, you get more space, but you also have the freedom not to clutter that space up. Because if you start with a big screen, it's very, very tempting to fill every white square on that screen. But when you start mobile, you start small, and it gives you the freedom to really focus on the content. We also had to have a new governance model. We couldn't continue with having 40 or 50 different people governing this website, because it led to poor content, it led to poor control, and it led to us not being able to steer this website in the right direction. So we made a new model through a lot of lobbying by the agency, and in the end, the management agreed to this. So we're 6 people on the editorial board. There's a web editor that does this full time, and then there are 5 others from different areas of the organization. There's a cancer nurse, there's me from fundraising, there's one person from our research department, there's one person from the prevention, and there's one person that knows a lot about like the rights, where you go to the government to get what you need when you get sick. It's not one person from every section of the organization anymore, but the 6 of us are responsible for all of the content. So it's our job to make sure that the parts of the organization that aren't on the board are still represented with their content. And this leads to much better control of the website. It leads to us being able to work very targeted, fixing one section after one section after one section, so that everything gets better all the time, and instead of worse all the time, which is basically what everyone has been doing up until now. So this works really well. And all of this together led to an overall much better website that lets the user do what they came for first, and then we introduce them to other things. And this is a big contributor to having more donations. Everything is much easier to navigate. You can find whatever you're looking for, which leaves you free to actually just do the simple act of donating when you feel like it. So I want to show you a little video. And unfortunately, this is very representative for most charity websites. Do we not have audio? There we go.
Hey, just that, thanks.
You sure?
Hola. Yeah.
Username?
Sí, ¿estás seguro?
Nikan?
No.
Nikan?
NM 1983?
No.
1973?
Zandy Pops. Sorry.
Pops?
Zandy Pops?
No, okay. Don't worry, I'll help. What's your postcode?
Sí, bueno.
Oh, it's a GU749ZT.
Código postal.
Welcome back, Nick Forever. Please listen carefully
bueno,
to this
Nick
bread
Forever.
license agreement before continuing with your purchase of a loaf of bread. If you do not, blah, blah, blah. You also agree not to use any bread-based products for any purposes prohibited by United Kingdom law, including without limitation design, development, manufacture of missiles, chemical, nuclear or biological weapons.
Jurídico, le recuerda que no puede comprar ningún tipo de
I'm afraid you've timed out.
What?
Dice, lo siento, tu sesión ha expirado.
Hello?
Perdona,
Excuse-
oye, ¿qué te
Oh,
pasa?
yeah, hey.
Just one loaf, sir.
Sí,
Yeah, we just...
What's your username?
solo un paquete de pan.
It's Nick Forever,
Sí, ¿cuál es
but
tu-
number 4, not the...
¿Cuál es tu
Gotcha.
Yeah.
Okay, I'm just going to check that you're a real
número de
person.
usuario? Nick
Could you
Forever,
say that
con número
for me?
4.
That's not even a word.
Okay, how about this one?
You know what, forget it.
Or this one?
Potter mice.
You're in.
Great, I'm in.
£8.85.
It's supposed to be 98 pence.
Plus express delivery.
What's that?
Oh, well, it's express delivery. It's fast. So there's, standard.
Standard.
Standard delivery. That's £4.99.
Why?
Bread insurance. You didn't untick the don't decline bread insurance option.
You know what, I think I'll risk it.
It is quite close to the sell-by date.
Don't care.
98 pence it is. If you want to pop back in 5 business days, it'll be ready for your collection.
Well, I need it now, obviously.
Oh, OK. You want the take-home today price? Well, that's £3.27.
You know what, I'm going to go.
Come back soon.
I won't.
Dear customers, this call will be closing in 10 minutes. Please proceed to checkout. Please proceed to checkout. Thank you.
Anyone recognize that? Yeah. Anyone think that they're giving their donors on their website the same experience? No one. That's very good. We were. And so one of the things that was most important for us was to fix this. We needed to give our donors a good experience, not bother them when they were trying to give us money. We needed to make filling out a donation form feel like the act of giving itself. So there's a very great guy called Luke Wroblewski. I don't even know how to pronounce that. But he said something profound, which is the best forms are invisible. So if you're not even thinking about the fact that you're filling out a form, that's good, because it needs to feel like the form is just part of doing what it is that you should do, not a hindrance on the way of getting to the end goal. And step one for making that is making forms that are easy to understand. The following slides is from a brilliant interaction designer called Ida Olen, who is the interaction designer on our redesign, and she works for a company called NetLife Research. And so this is your standard web form, and it looks very good to me. The forms are clear and uncluttered. There isn't too much information on there. It looks like a very good form, but there is still a lot we can do to actually improve this form. First and foremost, we need to adjust the length of the input fields. I don't know if you noticed, but if you look at zip code, and now look at zip code, we shorten it. Because people don't read labels. We perceive information with our eyes visually, and we don't necessarily read it. So the length of an input field actually tells you what's going in there. When it's short, you think, oh, this is the zip code, because that's what usually comes at that place in the form. And you don't necessarily read the label. Another thing we need to do is group the fields that belong together. So you get first name, last name, they belong together. Then you actually space out before you get to the address fields, which belong together. This makes it easier also to just perceive the information visually of what you're going to be filling out where. Secondly, the buttons need to clearly state what it is they do, not reset and OK, but cancel and save. Very often on a donation form, the button might say OK, and I don't know what that means. Does that mean that in this minute I'll be losing money or giving money? Or does it mean that I'll be moving on to the next step? Does it mean I'm creating an account? I don't know what OK means. So we need buttons that are clearly labeled telling us what it is we're about to do. And secondly, we need to remove the buttons that hurt more than they actually help. Why would you on a donation form have a reset button or an empty form button? It might help the donor if they want to clear the form, but why would a donor want to do that? The only way they would want to do that is because they are not thinking about not donating anymore. If they want to do that, they can do it manually. remove the reset button. All we want you to do is move forward into the next stage of the donation. And the error messages must clearly indicate which field is wrong, what have I done wrong, where is the error, how can I fix it. All too often you'll find you press next step or OK or save on a form and it will just refresh and you don't know what you did wrong. And so you have to start looking through everything. And that leads to conscious thought. And like we said, giving a donation is an emotional act. And the minute you introduce rational thought, we're losing money. Not being clear in our communication is introducing rational thought, which is losing us money. So step 2, and this is a big sin for most charities. Don't ask for more than what you actually really, really need. There's this habit of letting our database guy or our developer make our donation forms. And what they do is see, well, okay, so what does the database need? And then they recreate that on the front end towards the user. But the user doesn't need to know what your database looks like. The user should never even know that you have a database. They don't need that. All they need is to be able to fill out a form that lets them do what they came for. So you should never, ever turn your database inside out towards the user. And this goes for the language, and it definitely also goes for the types of forms that you have. I have an example here. Well, this is a horrible donation form in many, many ways. First of all, their smallest donation default is $100. So you're going to feel very, very cheap no matter what you're doing. $10,000 is up there. That's just crazy. Nobody goes online to give $10,000. But if you look at the fields here, you've got address line 2. Does anyone know what their address 2 is? No, because most people don't have one. You might need one if you're a company and you have a second billing address, or your address is so long that it doesn't fit on the one form, but it's just a tiny, tiny percentage of people would need that. What you're actually doing here is making most people feel stupid because they don't know what address 2 is. Should I have one? Should I know what it is? I don't know. I'm confused, and so I'm moving away from this form rather than filling it out. We'll scratch that out. But also we should, we have title up here. And I know that in some countries titles are more important than others, but still, it's not mandatory. You don't have to fill it out. Then why leave it up there? Take it out. Take out address line 2. Making someone think about what is my address line 2 is most definitely introducing rational thought, and they are no longer remembering that beautiful video that you made that made them want to support the cause. They're thinking, what the hell is my address line 2? And then they have some other information up here that's not mandatory. You've got state. It's not mandatory. Then why are you asking me? If you don't need the information, why are you asking me? Take it out. And they're also asking you about your province. Again, not mandatory. If you don't need it, why are you asking me? Take it out. Get rid of it. And just by doing these things, we're reducing the amount of information that we need the donor to remember and recall and write in and think about. Then you get to, this is an extremely long donation form, so I couldn't even fit it all in one slide. So the second half of the slide is where we get to what's important to the donor, the top part, where you actually put in your credit card information. That's the only part that's relevant to the donor. That's the only thing they need to do in order to be able to give you a donation. So that's okay. And then they have a multitude of subscription options you have to consider before being allowed to donate. And these are perhaps questions that are better asked later or not at all. Away with it. We've actually gone very far in reducing the amount of information we ask for, and we're testing this out, but we're doing it in our campaigns, where we know that we are reaching a lot of people that are not normally our supporters, people who want to give this once because they saw our ad on television, but we know that they're not necessarily going to become regular donors, or they're not very good leads for building a relationship with them right now, but we want to make it so easy to give that money that they will at least give us that one-off donation, so we get the money, and we still have a few ways of contacting them. So all we're asking them for is their first name, last name, and their email address so we can send them a receipt, and that's it, nothing more. And of course, what we do is we take their email and we send them an email afterwards saying, if you want your tax deduction, we need more information about you. So you can come in here and give us more information, and then we can start building a relationship from that end. But that is a much better way of working, we think. I can't really prove it yet, but maybe next year I'll come back and hammer it in that this works. Clearly labeling what information the donor has to fill out and which information they don't have to actually also leads to a lot of increase in donations. This is not a donation form, obviously, but this is a contact form from a company. And once they put that optional in there, twice as many people filled out the form with or without their phone number. Because that thinking that you had to fill your phone number out was actually holding some people back. They were thinking, I don't want people calling me, and so they skipped the whole form altogether. So just stating that the phone number is optional, twice as many people actually sent the form in. That's a huge value to the company. Another example is this. This is also a contact form for a company, and they originally had 11 fields on this form. And it was really useful to the company. They were asking, is your question about this? If it's about this, which department do you think it's about? You know, all these things that help them have the contact form go to the right person straight away so that they could fix the problem immediately. But of course, it was way too much information for the person filling out the form to process. So once they removed a lot of them from 11 to 4 fields, they had a 160% increase in the number of people who actually sent the contact form in. So every extra input field you put up there is damaging your conversion. So you need to think really long and really hard about, do I really need this piece of information, or is it just nice to have? Am I just asking this because we've always asked this? Am I just asking this because it's in the database? Do I really need it? Can I maybe ask about it later? Yeah, that's really important. So step 3, that's making me want to fill out the form. And to do that, you kind of have to think about forms as a conversation. But what kind of conversation do we want? Do we want a conversation that feels like you're standing on the customs border, trying to get past? So it's really important to be considerate about what kind of conversation you have. And I guess if you think about it, in your organizations, you have people doing face-to-face fundraising. What kind of conversations are they having? Like, Jacob, come up here. I want to do a demonstration. Now, I don't do face-to-face fundraising, but just pretend that I'm really good at it, and you're really persuaded by what I'm about to say, okay? Yeah. Hi, I come from the Norwegian Cancer Society, and we do some really great work with this research. Have you heard about it?
Yes.
Yes. And do you think it's good that we do this kind of research?
Oh, I think it's very important.
Do you know that we are not government funded? We rely on the support of every man for this to be able to do this work. Did you know that?
No, I didn't. Oh.
Yeah.
Hello?
Okay. Well, would you like to support us?
Yes.
Good. Name?
Jacob.
Man, amount?
I don't know how much.
Address line 1. See where I'm going with this? Doesn't really work, does it? That's not.
Can I go down
yes, you
again,
can down
please?
now. Yeah. That's not how you would do it, is it? No, that's not how you do it at all. You try to be nice and say, okay, what's your name, mister? And you'd say, and how much would you like to support us with? Yeah? You'd never speak to people the way we speak to people in our forums. So what kind of conversation do you want? If you ask questions, they should be a natural part of the conversation. And if you ask understandable questions, you will get answers. So saying just, what's your social security number? People don't know why you're asking. But put a parenthesis in there and say, so we can give you your tax deduction. People know why you're asking, and then they'll answer it. It's the translator is suddenly picking up on the mic, so I was hearing weird sounds over there. Sorry. And you need to explain why you need to know the things that you're asking. And if you have follow-up questions, they are better asked after the form has been sent in. Now, once someone has given you that donation, there's nothing stopping you from having a second page saying, thank you so much for donating. Would you also like to receive our newsletter? Or would you also like to volunteer? Or are you also interested in receiving, I don't know, something in the mail? And the microcopy. Just being friendly, that's really important when you're thinking about forms as a conversation. Now, this is an example, again, from our website, where our form, and where you would, before you would find the word amount, you are now finding a sentence that says, I want to give amount towards cancer research. Much friendlier, it connects me with the act of donating, and it makes me really think, yes, I want to give this money towards cancer research, rather than thinking about some demand that you're making of me. And the address field says, best regards, first name, last name. So I get to tell you that I am pleased that I'm giving this donation. So again, we're increasing your level of feeling pleasure in giving your donation. And again, it doesn't say email, it says my email address is, so it feels like a natural act to finish the sentence before moving on. Step number 4, making sure it works. This is our become a member form, and we were quite happy with it. It looks clean, it does the thing with grouping, and it does the thing with shortening of the fields. It's not as friendly as the other one, but we're working on that. And when we tested it, actually, what we found was that almost everyone were lost on the first part. And the first part over here is where you pick what kind of membership do you want. Are you a regular member? Are you a student? Are you a family member? Do you want a family membership? And for us, there was never any doubt, you know, a family membership, of course, that's a membership for the whole family, was our attitude towards it. We've never even thought about it differently. But what it turned out was the people were thinking, well, I'm related to someone with cancer. Does that make me a family member? Or I'm not a regular member because I've had cancer. So am I a regular member? And the family membership is more expensive than the regular one because it's for the whole family. And no one wants to sort of cheat the Cancer Society by picking the cheaper option if that's not the one you should have. But on the other hand, they're thinking, I don't want to pay too much either. So people were actually getting stumped by a word that we put in there on the very first field. So that's what we found when we tested. And we did that, we do that in labs. This is from the office of the agency that made our website. And they have these rooms where we can see people trying to find information on the website, and we can hear them, and we can see where they are clicking. And at the same time, there's a person sitting in the room with them asking them questions. What are you thinking? Why did you click there? What did you expect to find there? Did you find what you looked for? What didn't you find? Why did you think that piece of information was under that headline, et cetera, et cetera? And this teaches us so much about the way that people think, because we're biased. We know everything already, so we don't know that they don't have that piece of information. But you can also just do sort of guerrilla testing. You can, take the iPhone with the web page, go out into the street, walk up to the nearest person and say, hi, can you help me test this thing? Could you please try to find this piece of information on my website? And then ask them along as you go along. Or why aren't you finding it? What did you think was there? Where did you think it should be? Why did you think it should be there? And that teaches you so much, and it doesn't cost you anything, unlike renting a lab at a web agency. And there are many ways of testing. You've got what's called A/B testing, where you show your users 2 different versions of your website. So half the people will get version A, the other half will get version B. And that could be the shape of a form, it could just be a few different words, it could be having the optional text on or not, and you'll see which of them performs better, and you'll go with the version that performs best. There's user testing that we talked about, asking people what they're thinking when they're using your website. There's something called funnel analysis, where you go to Google Analytics and where you track people and see where are they falling off. And if you see if you can identify some areas where a lot of people are quitting the form, and then try to look at, okay, what is it about this part of the form that people aren't understanding, or that's offending them, or that they're not getting. And most importantly, talk to your customer service, because they know, because they get the telephones for people not being able to do what it is that they came there to do, and then they call you. So you can learn a lot from talking to your customer service. Now, I want to do some math. That's always fun. This is the reason why we are working so much on improving the conversions on our website. If your boss comes to you and says, I have 100,000, you can spend it on what you want. And you have a choice between buying traffic for your website, or you could give that money to an agency that can help improve the conversions on your website. So your situation right now is that your conversion rate, the number of people who enter the website and end up buying something or giving something, is 2% maybe. And your traffic is 1 million a month. So out of the 1 million people, 2% buy something. That means you have 20,000 sales. Now, the average person buys for 100, which leads you with a total sales of 2 million. Everyone following? Making people do math on a Friday morning after a party. That's great. Okay, so if you choose the option of buying traffic, you spend your 100,000 on buying traffic, and let's just say you get one more person per 1 euro or krona or whatever your I don't know the word, your currency is. Okay, so your conversion rate is still 2%. Your traffic is now 1.1 million because you have more people coming in. Out of that 1.1 million, 2% still buy, so you've got 22,000 sales. They still buy for an average of 100, which leads your total sales that month to be 2.2 million. Okay? So you got 100% return on your investment. You gave 100,000, you received 200,000 back. Now, if you spend that money on optimizing and you go to a firm that's not very good at it, so they're only able to improve your conversion rate by 0.1%. So now 2.1% of the people coming in are buying. 1 million people are still coming in, 2.1% of them are buying, which leads to 21,000 sales. They're still buying for 100, and your total sales are now 2.1 million. So you gave 100,000, you got 100,000 back. You didn't earn more money, but you didn't lose any money either. Now, if you go to a firm that's, okay, so they're able to increase your conversion rate to 2.5%. Now, your traffic is still 1 million. 2.5% are buying, which means 25,000 sales, which means 2.5 million in, which means you got 4 times your money back. You spend 100,000, you got 500,000 back. Or if you go to someone that's really, really good, maybe they're able to double your conversion rates. So now, all of a sudden, that 1 million people, 40,000 of them are buying, which leads to having 4 million, which gives you 1,900 times your money back. So this is why I always stress working with conversions. Always improving your forms, getting more people to fill them out, and getting them to give more money once they're there is just, it's the best use of money, because everything else that you do gets so much more worth. If you do advertising now, so many more people of those who come in will actually end up buying something, so you get more back for your money, whatever you do. And I don't know why charities are so unwilling to spend money on this. I think maybe we have this notion that the internet should be free, or we spent so much money on our website last year, aren't we done now? There are all these kind of things that we're thinking, but you're never done working on your website, because it gives you so much. It feels like a big investment, but it's the best money you can spend. So we've been through a bit about the donation forms and how to make them better, but there are other very important factors to consider when you're redoing your donation pages. And one of them is priorities. I don't know, has anyone heard of the paradox of choice? The paradox of choice is this idea that the more choices you have, it actually leads to fewer actions. And there was this guy who tested it, and the research that he did was in supermarkets, and he had people stand there with 6 different flavors of jam. And people would come up and they would taste the jam, and then when they get to the aisle with the jam, those 6 flavors were there along with all the others, and they would see how many people ended up buying jam. And then he had another group stand with 24 flavors of jam for tasting, and those same 24 flavors of jam on the aisle, and they would count how many people ended up buying jam. And what they found was that even though a lot more people came to taste when they had 24 options than when they had 6 options, actually way fewer people ended up buying when you had all the options rather than when you had the 6. The complexity of the choice actually gets too much for you. You can't decide because you've got 24 things to choose from, and you don't have enough information to know which is the best. You know, the price difference isn't that big, so you don't really care about that. You don't know what they all taste like, so you don't really care, and frankly, you don't care that much about jam. So the complexity of the situation just gets too much, and you leave the store without buying jam. And that's the same on our websites. Now, I don't know about you, but we most definitely did this on our websites. There are all these different types of supporting us, and we don't want anyone missing out because they didn't find what was appropriate for them. And you know, if you're only willing to do one thing but not willing to do the other thing, we can't exclude the one thing, even though it's not worth much to us, but you know, we might get you later on, you know? So we keep presenting everyone with all of our choices all at once. But this leads to confused donors. They're standing there and they're engaged because they just saw that one video where you asked them to fix that one thing. And they're like, wait, how do you want me to fix it? Should I follow you on Facebook? Does that fix the problem? Do you want me to sponsor someone? Do you want me to become a recurring donor? Do you want me to make a one-time gift? What do you want me to become a member? Should I volunteer? What is it that you want me to do? The donor doesn't know, and we're leaving the donor with a choice, which leads to them leaving. So what we need to do is that we need to make the hard choices for the donor. We need to decide that this is what we think you'd like to do. This is what you should do if you haven't decided to do something else. If you're in doubt, this is what you should do. We're the ones who have to make the decision. And so this is what our donation page looks like now. We thought that the one action that people are most likely to take when they come into our website and they want to support us, the action they're most likely to take is to become a donor, to just give a gift once. And so we put the donation form right up there. And all the other options, they're still there. They're just below. So if you want to give a gift in memory of someone, the option is still there. If you want to become a member, the option is still there. But if you're in doubt, we've told you what we think you should do. And I think this is one of the most important things that we did that led to the doubling of income that we actually had. We also made the forms portable, which means we can create dedicated landing pages. This means that if I post on Facebook a story about research, which is a very well-written piece, it talks about this one researcher and the work that he does. It talks about the patients that are benefiting from his work. What I can do then is, rather than have you look for the support us button when you become engaged by this, is that I can actually put the form right there. And you don't have to make the choice what type of support you want to give us. I've told you this is what you should do. And it's right there. You're still in the same emotional state because you've got the text or the video, if it was a video. It's right there with you. And we're keeping you in the mental state that you were. We're not chasing you out into other parts of the website, making you look for things and search for ways to support us. So this is also a very important success factor for us, being able to create these dedicated landing pages. Plus, it makes me very, very happy when I can do that. In 5 minutes, I can make a new website. The same with the other options. So we had for the membership, which is really important to us because there are political support. They're not that important in a monetary sense, but they're very important when we go to the government to say, hey, we have 100,000 people with us when we are making this claim, something we want changed. So our members are very important, but they're not the top priority on the website. This just means that we made a dedicated page, that we use that link rather than the main link for the Cancer Society page whenever we're communicating, wanting someone to become a member. And so they've got this dedicated form for that. I want to show you some of the results that we've gotten. And I'm very proud of these results. And it's extremely fun for me to be able to say, I told you so, to everyone who said we don't make that much money online. I said, well, it's because we're doing it wrong. And now I can actually prove it, and that's really fun. For recurring gifts, so people who sign up to give a monthly donation. Anyone want to guess how much more? It's 88% more. And this is just in 1 year. So this was version 1 of our donation forms. And I think it's going to be increasing even more when we're able to do more tweaking, fixing the forms even more, working with the texts more, working with the content around it more. And I think one of the most important factors is before on the old website, we used to make a monthly donation. It was its own option, besides making a one-off donation or becoming a member or giving a gift in memory. But now it's right up there with making a one-time donation. So we're sort of, as you're about to give, we're reminding you that you could give once a month. Actually, we changed just before the summer, we changed the default setting to being a monthly donation rather than a one-off donation. And it's such a short time ago that we don't really have numbers on it yet. But my expectation is that will make that 88% number go up even more. So now you have to choose, you have to sort of say, no, I don't want to give once a month, I want to give just this once, rather than say, well, that was a good idea. So we think that this will make more people actually say, yeah, why not? I could give a donation once a month. For the total sum of money giving in one-off donations, so people coming in making one gift, we have an increase of 72.8%. And remember, this is all while fundraising isn't a priority on our webpage. Can you imagine the increases if fundraising was actually a priority on the webpage? This is just by fixing the interaction design, by making it easy and friendly and short. That's all we've done. There's no huge button on the front page suddenly bringing lots more people into the donation pages. There's no huge campaigns telling people, go support the Cancer Society. This is just from fixing the website. And the website was fairly okay to begin with, but just that, those last screws, fixing those last bits has such a big impact. And even though this is one-off donations, of course, this does not mean that they won't give again. We still have their address and their email, and we'll send them stuff, and they might become recurring donors in other senses. It just means that they didn't choose to do that right now. The number of donations, because the amount could go up, but without actually the numbers going up, because it could be people giving bigger gifts. But it's a bit of both. So the number of donations have gone up with 70%. So you can see that the amount has gone up slightly more than the number of people donating, which means that there are more people giving more money. And one of the most important tools we've had for that is fixing the default amount. So we tell people what we think, or what we suggest. We make a suggestion of what you should give. This example shows the monthly donor, but it's the same for the one-time amounts. So you've got a default amount set there, but you can, of course, click it, and you get a few other defaults suggested to you. Or you can click, I want to decide the amount myself, where you get a blank field where you can just fill out. One of the things that that we had to fix, that we found in user research that wasn't actually working, is that initially, like, again, I know you can't read this, but this says kroner, or it would be euros for you. It would say euros behind the field. And that wasn't there initially. And what we found was that actually the form, or the field where you'd put the amount in, was too long. So people started writing kroner in the field next to the number, which means that they would get an error message and they couldn't actually move forward. So fixing this, also big increase in donations. So working with this the default number is one of the big reasons why the average donation is going up. New members, this is a big one. It's a 165% increase. And on our former webpage, membership had a huge part of the front page. They had a huge banner there, but nobody clicked it. First of all, you're banner blind, so you don't see it. But on the other hand, you weren't there to become a member. You were there to read about cancer. So that's where you went. And then you never saw that banner again. Actually, you probably never saw it in the first place because it came from Google. So even though members aren't a priority on the new website, this is the one that has the most increase. And I think there are a few reasons for why these are increasing when they're less prominent on the web page. I think it's because we use this dedicated landing page where you just become a member. And we can use it portably so that if we are writing a piece about something that we need political clout to do, where we really need the backing of the people, we can put the membership form in there so that they know that the way I can help with this is by becoming a member rather than making a donation, because we've told them, this is what we want you to do, this is what we need you to do. And again, becoming a member is a dedicated act. It's a much more, you need to be much more decided to become a member than you need to be to give a one-time donation, just give some money away. Becoming a member is a commitment. So if you're much more likely to actually have decided beforehand that you need to be, that you want to become a member. Maybe you've had cancer yourself, and so you say, I want to be a member of this organization, and then you, of course, you go look in the menu and you find the membership. Because now it's actually easy to find because the website isn't cluttered. The average donation has gone up so far with 20 Norwegian kroner. That's about 3 euros. That's so far. I think this one will go much higher in the near future. Our default amount used to be 250. That's the blue line you'll see up there. So the first part of the graph you're seeing is around Christmas. And at Christmas, people make larger donations already because maybe that's the one time a year they give. So what they do is they gave 500, so you'll see both the 250 and the 500, they're quite equal, even though our suggested amount was 250. And then Christmas was over. And this is where you'll see the blue line go straight up. This is when people were no longer in the Christmas spirit, so they were giving our suggested amount. So the number of people giving 500 went up, the number of people giving 250 went up, the number of people giving 500 went down. And then in May, we changed the default setting from 250 to 500. And you can see what the purple line does, the 500, it goes straight up again. And the 250 goes straight down. People are giving the amount that we are suggesting. They're still, of course, able to change it. And we have monitored a lot of other numbers at the same time. We've checked to see are fewer people giving altogether because they're getting offended because we're making such a high request. And no, they're not. And are the people who are choosing not to give 500 then maybe giving 100 rather than 250 that they would have done before? And they're not. The only thing this seems to be affecting are the people who are choosing the default option. And now they are choosing our default option, which is twice as much as it used to be. So I'm very, very interested to see when Christmas comes this year, because Christmas last year, our suggested amount was 250. So I'm sure a lot of people gave that because we suggested 250. Now this year's Christmas will be suggesting 500. So it's going to be really interesting to see what the amounts we get for Christmas this year will be. And I'm sure I will blog about it when I'm done, too, so I can share the results with all of you. So this is where we're at. In summary, our recurring gifts are up 88%. Our total in one-off donations is up 72.8%. The number of one-off donations is up 70%. Our members, that's completely wrong number, it's up 165%. And the average donation is up 20%. So this makes me very happy. And actually what we can see, is these are the average numbers for over a year. So what we find, say, at Christmas, where people are, not that dedicated, they're just in there because they're looking for someone to donate to for Christmas, and they are more easily persuaded to give. We can see that the increase in the people making a one-time gift is actually as high as 250%. The increase last Christmas was 250%. But on a year-on-year basis, it's 70%, which is a huge difference. We are millions ahead of last year already. And if you look at the recurring gifts, we are already ahead of last year, and people are pledging more money than they used to. So they're more valuable. And this means that already the people who have become a recurring donor today, they are worth more already this year than they were all of last year. So it's, I'm very happy about all this. I'm walking around the halls at work, dancing around the halls at work, telling everyone I told you so, and being very happy about it. But we're not done yet. We're continuing to work on our donation forms. We're continuing to work on improving our conversion rates because we see how much more money we get from fixing these things, focusing on the interaction design. And I've seen so many campaigns let down by that. You'll see they've made a great campaign website that's really compelling. And once you click donate, they've decided that that's where you want to save money. So they use their old form, which is huge and clunky and asks for way too much information, and it just lets the entire campaign down. And I don't want to see that anymore. So I'm hoping that this might prove to you that it's really worth spending the money on a good interaction designer, getting someone to fix your forms, because you are losing out on so much money by not doing it. That's all I've got today. And I was told to leave 15 minutes at the end for questions, so I've done that. You may ask your questions in Spanish if you like, because we have a translator, so I can hear them if you have them. So any questions? Yes? English or Spanish? English, okay. I don't need this then.
For the one-off donations, do you give the option to dedicate the money that they give into a project? Do you recommend that, or is that making things more complicated?
Yeah, we don't do that. That's not because that's a bad idea in the first place, because we know that letting people choose a project might get them to actually give more because it's closer to them. But we haven't found it natural to do that in just our regular donation form. We don't do earmarking that much, and we don't really want it because it makes it hard for us to actually spend that money, so we don't do it. But we will be doing it in our, well, this isn't really public knowledge, but we will probably be doing it in our Christmas campaign this year. We'll let you choose a hospital that we will send a decoration to. So that's going to be making it close. So that's a very good tool to use at the right place. Yeah. Yes.
En español.
I'll get this one then.
I'm actually gonna ask the question in Spanish. So I have realized in some landing pages you use videos. Are they more useful? Have you noticed any increase of donations with videos? Or is that not that remarkable? Is it advisable to use videos or not?
Yes, now I can hear you.
Repita la pregunta.
I have no idea what that means. Sure. Okay, got it. Very good question. Yeah, I think using videos is a good idea, and using videos on the landing pages too. The reason we haven't done that yet is because this has been such a huge project that we have just focused on getting the main parts in place for now, the main content, the forms, getting them to work, and then now we'll start working with putting videos in, because that is much more compelling often than any text. It just needs to not get in the way of what people came there to do. But yes, I think definitely videos is a good idea. Yeah.
Now, una pregunta más. No sé cuánto es útil, pero ¿sería mejor poner el video abajo del form o arriba antes de pedir la donación?
I think that depends on the type of page. Like if I'm telling a story and I'm posting this story to Facebook about, maybe it's an interview with a researcher that tells about the work he does, I would definitely put the video first, because that's the main content. But if the video is just supporting content, I might put it below. But it's all depending on the situation and the type of page and story you want to tell. Yeah. Any more questions? Hi.
Thank you, Beate, for your very nice presentation. And I would like to ask you for your experience with A/B testing and
Sorry, what? With
A/B testing.
Yeah.
And if you are using Google Analytics or any other tools that are in the market.
Mm-hmm. Yes, we're using Google Analytics. We haven't actually done A/B testing on this page yet, because again, it was a huge project, so we just haven't gotten around to setting that up yet. But that's, hopefully we'll have it in place before Christmas. But the agency that we work with use A/B testing all the time, and they have great results with it. You can, just change a single word and see, if donations go up or down. But we will most definitely be using it, hopefully as soon as possible. Yeah. More questions? Yep, right here. So 1 second, we'll give you the mic.
Hola, quería saber si tienes algún tipo de información sobre conversión de fans Facebook en socios regulares o puntuales.
I don't have detailed information on what kind of donations Facebook fans make. But the very interesting thing that we see is that, like, if you have the age group of our members, they are like this, getting older and older, and then they only quit because they actually die. And that's because that's the part in your life where you are most likely to become associated with cancer, so that's very natural. But what we do know is that a lot of people in the middle age group, they say maybe from 30 to 50, a lot of people there are affected by cancer too, but there are not enough of them for us to target them with any marketing, whether it's for support or for donations, or for our support for them. But what we see is that this is actually the group of people that are on our Facebook page. So they are seeking us out. So they are representing a target demographic that we know is important, but that we haven't had any way of reaching before, but now we do. And what we know then is we don't use our Facebook page very much for asking for donations. What we do is we try to show them our worth. We show them our value. We are there for them, we answer their questions, we talk to them, and then every now and then we ask for a donation. But we might not do it directly on the page. We would say, so here's a link to a story about a scientist, and if you're interested enough to clicking that link, you're reading the whole story, and if you're interested enough to read the whole story, you'll find the donation form at the end, and then that's really relevant for you because you're that interested. And we have seen that that has very good results doing it that way. But there's not a big difference between what they're signing up for, being a member or a regular donor or a one-time gift, because that all depends what we ask them for. That doesn't quite answer your question, but I hope it somehow does, yeah. There's a question up there.
You talked about how to improve the form, the donation form, but how did the people who donated to you come from? Were they via, email marketing? Did you send emails, which I think is the most used way to get people to your donation forms? Or do you receive visits from people who just visit your website? Social networks, or what else? Yeah.
This is actually mostly people that just visit our website on their own, out of their own agenda, whether it's to read about cancer or read about prevention. But mostly this is just from people coming to our website. So what we've been doing for the past year and a half is actually fixing the website, and now it's so good that we can start spending more money getting people into the website. So yeah, we do email, but our emails are not extremely donation focused. They're telling bits of information, but again, it's by working through context. So we'll send you a piece about research. When you get in there, there will always be an ask at the bottom. So it's from everywhere. It's from the traffic that we bring in from Facebook, it's the traffic that we bring in from emails, and it's the people who go to Google to search for information about cancer. So it's, yeah, it's not one huge traffic channel that I can pinpoint. Any more questions? I don't see any hands. Okay, so I think that's it then. Thanks for listening to me.